Drip bars, wellness IVs, hydration therapy. It first gained popularity as a quick hangover fix following a long night out. Now it's evolved into customized treatments.
After one IV bag, they'll feel, most time they're going to feel a major difference in their energy levels.
Chiropractor Ryan Russell is the clinic director at Vital Force in Hoover, which offers around 24 IV treatments.
We have IV bags for migraines. We have IV bags for patients with gut issues. We have IV bags and things for mold exposure, so the list goes on and on.
Offering fluid isn't always a first stop for doctors in traditional medical settings.
The clinical aspect, there isn't too much evidence-based support overall for it.
Dr. Ian McCagg is a sports medicine doctor. He enlists in IVs to speed up recovery for athletes.
Doing so with a specific purpose where rehydration is something that needs where time is of the essence, and what folks don't realize is while we're giving them a IV, we're also giving them oral fluids.
While there are a few side effects for those who are healthy, McCagg says it isn't risk-free. He doesn't feel this treatment is appropriate for pediatric patients and those with certain conditions.
Congestive heart failure, and then those with lung-related issues as well, and I guess while we're on it, kidney issues. So those are kind of the three main organs that really have some additional stress with IV fluids.
For perspective, it takes a doctor's order to receive a bag of fluids. Most clients who visit an IV lounge don't see a doctor. But there are some like Russell's clinic that offer patient-level care.
Come in, you become a patient, again, we're going to check your blood pressure, we're going to get a full kind of health history, again, make sure there's no contraindications on any type of medications that would interact, with any of our vitamins. Again, even though they're all natural, we still like to just take that extra step. Make sure, because again, if a patient has too high of a blood pressure, we don't want to be giving them lots of extra saline and fluids because it could raise the blood pressure and cause health issues.
It's difficult to determine whether the drip bars are practicing medicine by Alabama standards. That's why it's important to first discuss this with your doctor. If given the green light, do your homework, inquiring about the saline bags, whether the vitamins are medical grade, and the qualifications of those who are giving your IV.
Looking into the sterile environment, ensuring that that you just ask questions about the process as a whole. Where is this stored? Is there an expiration date on this thing? What is the expiration date?
On average, the treatments start around $100 and can go beyond $500. Russell says most need about 2 treatments a month for maximum benefit.
Let's say we were doing blood work on patients. If they want that, if they're getting their 2 IV bags a month, their vitamin levels always look really good. They're at that optimum level medically.
Traditional medical experts debate the effectiveness of some vitamins.
One of my old mentors used to tell us that us Americans have some of the most expensive urine in the world. And it's because we take so many multivitamins, and then our kidneys filter it out, and then and it leaves the body. And so we don't really use most of what we're taking in.
It's important to note these businesses aren't directly regulated by a state agency or a set of protocols. In our effort to determine who is ultimately responsible for these treatments, it appears to fall to a medical director who is licensed through the state or other licensed providers. Some states have specific regulations that require a doctor to own the business, conduct good faith examinations prior to administering an IV, employ registered nurses, and determine how the IVs are prepared and stored. Jennifer Horton, WBRC, Fox 6 News, on your side.